You are walking down a flight of stairs, and suddenly, a sharp, burning, agonizing pain explodes deep inside your knee. Your leg feels weak, almost as if it is going to buckle and collapse underneath you. You go to a local orthopedic clinic. The doctor takes a quick X-ray of your knee, points to some mild, normal, age-related wear and tear, and diagnoses you with knee osteoarthritis. For the next year, you follow their exact instructions. You swallow daily anti-inflammatory pills. You endure agonizing physical therapy to strengthen your knee ligaments. You spend thousands of euros on hyaluronic acid and cortisone injections directly into your knee joint. But the pain never stops. In fact, it starts to radiate up the front of your thigh. If you are experiencing this cycle of endless failure, you must immediately stop treating your knee. You are the victim of a massive medical misdiagnosis. Your knee joint might be perfectly healthy. You are suffering from a crushed spinal nerve. And today, we will explain exactly why your doctor is looking at the wrong half of your body. To understand why your knee aches when the actual mechanical failure is in your lower back, you must understand the complex electrical wiring of the human body. Think of your spinal cord as the main electrical breaker box for your entire physical structure. The nerves that exit this box travel down your legs and act as the electrical cables that provide power and sensation to your lower body. Most people have heard of the sciatic nerve, which travels down the back of the leg. But there is a second, equally important electrical system called the femoral nerve. The femoral nerve is formed by nerve roots that exit higher up in your lower back, specifically at the L2, L3, and L4 spinal levels. This massive electrical cable travels through your pelvis, down the front of your thigh, powers your heavy quadriceps muscles, and provides direct sensation to the front of your knee. If a mechanical failure in your lower back, like a herniated disc, crushes the L3 or L4 nerve root, the brain receives a massive, chaotic distress signal. Because the endpoint of that specific wire is located at the front of the knee, your brain assumes the knee is being destroyed. The pain is very real, but it is referred neurological pain. The appliance is perfectly fine. The short circuit is happening inside the breaker box in your spine. This anatomical reality exposes why traditional knee treatments completely fail for this condition. When a local doctor or physical therapist assumes you have a failing knee joint, they focus entirely on the local cartilage and ligaments. They inject highly powerful synthetic fluids or steroids into the knee capsule to stop local inflammation. Sometimes they even perform a knee arthroscopy, inserting a camera into the joint to scrape away healthy cartilage, looking for a problem that does not exist. If the pain is actually a false alarm generated by a crushed L4 nerve in your spine, these knee treatments are a catastrophic waste of time, money, and biology. Injecting steroids into a healthy knee will only degrade your natural joint tissue over time. Scraping healthy cartilage permanently damages your mobility. Furthermore, aggressively exercising a weak knee will do absolutely nothing to relieve the heavy mechanical pressure that is actively suffocating the nerve cable high up in your lumbar spine. You cannot put out a fire in your ceiling by spraying water on your floor. We cannot solve this mystery by guessing or staring at a knee X-ray. We must act as elite medical detectives to differentiate between true knee joint pathology and spinal nerve compression. There is a very specific, undeniable clinical pattern we look for. True knee arthritis or a torn meniscus usually involves visible physical swelling of the joint. It often causes mechanical locking or clicking, and the pain is highly localized when the doctor physically presses on the outside of the knee. If your knee pain is caused by a spinal nerve, the pattern is entirely different. Your knee will look perfectly normal from the outside. There is no swelling. The pain often gets worse the longer you stand or walk, and the burning sensation radiates upward into the front of the thigh. The most critical clue is neurological weakness. The L3 and L4 nerves control your quadriceps, the large muscles on the front of your thigh that allow you to straighten your leg. If your leg feels like it is giving out when you walk down the stairs, or if a doctor taps your knee with a reflex hammer and your leg fails to kick forward, the knee joint is not the problem. Your nerve is dying. When an elite neurosurgeon sees these symptoms, we immediately abandon the knee and order a high-definition magnetic resonance imaging scan of the lumbar spine. When we evaluate the lumbar MRI, we focus intensely on the mid-lumbar segments, specifically L2, L3, and L3, L4. We look at the axial, top-down view to measure the exact millimeter of clearance around the exiting nerve roots. We must determine the exact nature of the mechanical clamp. Is the thick, rubbery wall of the spinal disc bulging outward and suffocating the nerve? Has the disc completely ruptured, allowing a fragment of highly toxic, inflammatory gel to leak out and chemically burn the nerve root? Or have hard, calcified bone spurs grown into the narrow tunnel where the nerve attempts to exit the spine? We map the exact millimeter of the compression. If the MRI shows a crushed L4 nerve on the left side of your spine, and you have burning pain and weakness in your left knee, we have a perfect mechanical match. The true diagnosis is confirmed. Because the knee pain is simply a false alarm caused by the lower back, our entire treatment protocol is focused exclusively on releasing the pressure in the spine. If the MRI proves that the compression is caused by a contained soft disc bulge at the L3-L4 level, we bypass massive open surgery entirely. We utilize ultra-minimally invasive techniques like percutaneous laser disc decompression. Under local anesthesia, we guide a microscopic laser fiber directly into the failing spinal disc. We vaporize a tiny fraction of the internal pressure, creating a vacuum that pulls the bulge away from the femoral nerve roots. If the compression is caused by a massive ruptured disc fragment or hard arthritic bone spurs, the laser is obsolete. We use advanced endoscopic spine surgery. Through an incision smaller than a coin, we insert a high-definition camera directly into the spinal canal. Using microscopic instruments, we gently remove the disc fragment or shave away the overgrown bone, physically freeing the trapped electrical cable. We do not use heavy titanium screws, and we do not destroy your back muscles. The moment the nerve is released, normal blood flow returns. the false electrical signals stop. Your quadriceps muscle regains its strength, and the terrifying stabbing pain in your knee permanently vanishes. Many patients live with severe, burning knee pain for years. They accept the agonizing daily routine because they trust a doctor who never bothered to look at their spine. They spend thousands of euros on useless knee braces, painful shockwave therapy, and repeated steroid injections that slowly destroy their healthy joints. But let us look at the true cost of getting this wrong. If you ignore a severely crushed nerve in your lower back, it will eventually suffer irreversible damage. The nerve will die from oxygen starvation. You will permanently lose the strength in your thigh muscle. Your leg will constantly collapse when you walk, and you may even be subjected to a completely unnecessary total knee replacement surgery. You are risking lifelong neurological damage and crippling surgery because your doctor is treating the wrong anatomy. For a fraction of the cost of useless knee treatments, you can have an elite neurosurgeon review your spinal imaging, potentially saving your nerve and ending the pain immediately. If this video helped you understand your pain, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution. But you cannot fix a mechanical spinal problem by guessing, and you cannot fix it by asking questions in a comments section. If you have an MRI, do not just read the paper report. Every spine is unique. Click the link in the description to upload your MRI or CT scans to our secure portal. Our neurosurgeons will personally review your imaging, trace your pain back to the exact source, and build your personalized, minimally invasive treatment plan. Stop living in pain and stop treating the wrong joint. Let us find your solution today.